In this video, you will learn how dangerous it really is to go without policies and procedures in your private medical practice. Hi, my name is Liz. Don't forget to hit the like button and subscribe to this channel so that you get notifications of future content. Not having policies and procedures in your private medical practice can pose several risks. So let's look at a few of them. First of all, it can cause you legal and regulatory compliance problems. Without documented policies and procedures, you may fail to comply with legal and regulatory requirements, which could result in fines, legal action, and loss of license. I'll give you an example. One of the most common is going to be HIPAA or a HIPAA violation. For instance, if you're a nurse at a hospital and your sister's husband comes in and sees a doctor there, and your sister calls you up and says, hey, I wasn't able to go with my husband that day to the hospital. Can you give me a rundown on what's happening? Can you look in the chart? It is against the law for you to share that medical information with your sister or sister-in-law unless you have written permission from the husband to do so. And if they do catch you, if someone reports you, let's say the husband found out, reports you, you can get anywhere from $10,000 up to, I believe, $200,000 in fines, including jail time. So it's a very serious deal. Something you definitely want to make sure to have covered in your policies and procedures for your medical practice. Okay, number 2 is going to be patient safety. So standardized procedures are essential for ensuring the safety of your patients. Without them, there's a high risk of medical errors and adverse outcomes. I'll give you an example of that as well. So inserting a catheter into a patient. That's going to be something you're going to learn in nursing school, and it's going to be something if you work in a nursing home especially, that you're going to do quite frequently. But as a facility, whether you're in a nursing home or a hospital or in a private medical practice, maybe where you have a patient come in after surgery that isn't able to empty their bladder, you still have to have a policy and procedure for that on hand. So that's one example of that. Another problem that it can also cause is inconsistent care. So lack of policies can lead to inconsistency in patient care, making it difficult to maintain quality standards and provide consistent treatment. This just applies to a wide range of things in medicine. If you go to the doctor, obviously you're checked in by a nurse, and if each nurse has a different way that she does her assessment, and I'm not talking about, everyone's got a little bit of a different personality, which is great, but literally like the assessment. If one nurse does it totally different than the other, the next time you go into the doctor, then you've got another nurse that does it a different way, and then the next time you go in, it's going to be the same thing, another nurse. You're never going to have this continuity of care where you're able to properly measure someone's blood pressure and their pulse and how they're feeling that day and all of those things. So it's really important that you have those policies and procedures in place so that you have a plumb line or you have a control to measure things against. Staff confusion. This is another thing that comes in very, very often. So your staff may be unsure of how to handle various situations, leading to confusion, miscommunication, and reduced efficiency. So let's talk about cleaning up after, let's say, a bodily fluid spill. Sometimes in the nursing home, it wasn't uncommon for a patient to fall and, hit their head and open their head. And if you've never seen a head wound, you would know that there's just a lot of blood. Even if there's not a major injury, your head just really bleeds a lot. It's very vascular. So you need to have a procedure for a way to clean that blood up, not only to make sure that it gets cleaned up properly, but to make sure that you are disposing of that stuff in the right manner, because when there's a blood spill, you have to put it in a biohazard container. There's all these different procedures. And so obviously you want your staff, again, I've worked lots of nights, even your night staff, to be able to pull out your policies and procedures if they've never done it and say, okay, this is how we're supposed to do this. It helps to give staff the confidence that they need to really be able to do their job well as well. Okay, and then also we have liability and malpractice. Poor documentation of policies can increase the risk of medical malpractice claims and liability issues. If you have nothing to show, if someone, calls on your practice and they are accusing you of something and you have no policies and procedures on hand to show the lawyer, their lawyer, your lawyer, then there's really nothing backing you up. It's the same with like nursing documentation. If you're a nurse, you know this, but every time you sign your name to something in the medical field is a legal document. So making sure you have policies in place for how you are to document everything in each situation and what the best practices are, that's also something that's very important. Also, reputation damage, like I was just talking about. Inadequate policies and procedures can harm your practice's reputation, as patients may perceive it as unprofessional or disorganized. Again, if you walk into a doctor's office and you've got a different nurse each time, and each different nurse has a different procedure or policy for the way that they handle intake of their patients, you're going to kind of begin to wonder what's going on and why everything is so different every time. So it's just really important to have those standard operating procedures, policies and procedures, and all that training in place, because it really elevates your private practice and proves and shows your professionalism. It also protects you. So those are just a few of the things that show why it is so important to have policies and procedures on hand, and why it's so important to understand that if you don't have policies and procedures in place, printed out, easily accessible, that it could actually cause you lawyer fees, loss of licensure for yourself and your clinic, some pretty serious things. So if you don't know how to put together policies and procedures, it is not something that is like readily taught in nursing school or doctor school. It's actually something you usually have to learn once you get out and you are part of a clinic. If you have questions about that, that's one thing I really enjoy and that I've actually done since I was very young. So if you need help with it, let me know. Or if you have a question about a specific policy and procedure in your clinic, feel free to comment below, and I would be more than happy to talk with you and see what we can get worked out. Hey, thank you so much for watching today. Don't forget, here at Curate Systems, we help you document it, delegate it, and get it done so that you can minimize risk and maximize productivity. See you soon.